Welcome everyone to this presentation. In this session, we will be discussing the revolutionary advancements in Parkinson's disease rehabilitation, specifically focusing on how dance therapy, virtual reality, and brain technology are unlocking new potentials for patients. Before we dive into the details, I must issue a brief disclaimer. Please be aware that the information and content presented in this video have been generated using Notebook LM and should be considered for educational purposes. We are witnessing a monumental shift in how we approach neurorehabilitation, moving far beyond traditional methods to embrace highly interactive, tech-driven, and intensely engaging modalities. This comprehensive overview will guide you through the latest scientific evidence, clinical outcomes, and innovative technologies that are fundamentally changing the landscape of patient care. Let us begin our exploration into the kinetic flow of Parkinson's disease. Now let us examine the profound paradigm shift currently taking place in Parkinson's disease rehabilitation. Historically, the old standard of care relied heavily on low-intensity physical maintenance, which unfortunately yielded only limited symptomatic relief. However, robust new medical evidence compellingly demonstrates that high-intensity training, or HIIT, is absolutely required for effective symptom management and long-term functional preservation. Specifically, clinical data indicates that a minimum training volume of 1,800 minutes, administered over a minimum effective dose period of greater than 12 weeks, is necessary to induce crucial multisensory integration and structural neuroplasticity within the brain. Furthermore, maintaining this high-frequency, high-intensity therapeutic regimen has been scientifically proven to provide sustained non-motor symptom relief for more than 6 months. This data underscores the critical importance of both intensity and strict adherence to modern therapeutic protocols. Moving forward, we must look at the hierarchy of physical interventions available to patients today. According to a comprehensive network meta-analysis ranking, dance therapy remarkably outperforms conventional physical therapy. It has shown the highest level of clinical efficacy when measured by standardized assessments, such as the Unified Parkinson's Disease Rating Scale Part 3, the Timed Up and Go test, and the Mini Best test for balance. Aquatic therapy ranks as the second most effective intervention, providing a safe, buoyant environment that reduces fall risk while allowing for dynamic resistance training. Coming in third is dedicated gait and balance training. This clear hierarchy provides medical professionals with vital, evidence-based guidance on how to prioritize therapeutic interventions to maximize motor recovery and improve overall patient outcomes. You might wonder, why exactly does dance therapy dominate the rankings for Parkinson's disease rehabilitation? The answer lies in its unique ability to provide profound multisensory integration, which simultaneously and effectively addresses complex motor symptoms, such as freezing of gait and dynamic balance impairments. Dance intrinsically incorporates rhythmic auditory stimulation through music, acting as external cues that help bypass damaged internal timing mechanisms in the basal ganglia. Furthermore, it naturally encourages motor scaling by requiring patients to take larger steps and utilize a broader amplitude of movement. Crucially, the engaging nature of dance promotes significant dopamine release, fostering positive neuroplasticity, while the inherent social engagement greatly boosts motivation and psychological well-being, creating a holistic therapeutic environment. A critical concept in this field is the use it or lose it activation and decay curve, which emphasizes that continuous intervention is absolutely mandatory for sustained functional improvement. Clinical observations reveal that patients typically reach their peak therapeutic efficacy, measured by significant improvements in motor scores, at approximately 3.5 months of continuous high-intensity training. However, the benefits are highly transient if the therapy is stopped. The data shows that a significant functional regression occurs after just one single month of physical inactivity. This dramatic decline highlights that Parkinson's rehabilitation cannot be treated as a short-term intervention. Rather, it requires a lifelong, unwavering commitment to continuous, high-volume physical engagement to maintain neuroplastic gains and prevent rapid motor deterioration. Beyond the strict biomechanical and physiological benefits, PD dance serves a vital psychological role by helping patients reclaim their artistic expression and personal identity. Parkinson's disease often strips individuals of their confidence and isolates them from society due to the visible nature of their motor symptoms. Dance therapy functions as much more than simple exercise. It actively fosters a supportive community, aggressively fights the pervasive issue of social isolation, and helps rebuild a positive self-image. This restoration of vanity and self-worth is deeply intertwined with the neurological release of dopamine. By engaging in artistic expression within a safe, non-judgmental group setting, patients experience elevated mood and renewed self-confidence, which synergistically enhances their physical motor performance and overall quality of life. This brings us to the crucial mood-motor connection, which demonstrates how closely psychological well-being is linked to physical capabilities in Parkinson's patients. Scientific studies have shown a direct and powerful correlation between positive emotional states and significantly faster completion times in the timed up and go functional assessment. When a patient experiences an elevated mood, mediated by the prefrontal cortex, this directly facilitates improved motor rhythm and smoother execution of movements. In fact, clinical trials have revealed that 66% of patients showed a measurable elevation in mood following targeted exercise sessions. This positive emotional state triggers natural dopamine release, leading to enhanced basal ganglia activation, thereby creating a highly beneficial feedback loop where better mood leads to better movement, and better movement further elevates the mood. Let us now turn our attention to specific biomechanical challenges, such as festination, which is characterized by short, rapid, and shuffling steps during the gait cycle. In conjunction with orthotics, targeted physical therapy protocols like LSVT-BIG are employed to actively force kinematic correction. By forcing the patient to execute movements with an exaggerated, elongated stride, the therapy effectively recalibrates their internal sensory motor perception of what constitutes a normal movement size, helping to overwrite the disease's tendency to minimize physical action. For patients in the advanced, severe stages of the disease, specifically HONE and YAR stages 4 and 5, conventional physical therapy is often impossible. Here, virtual reality innovation offers a groundbreaking solution by untangling the neural strings that restrict movement. We utilize virtual reality somatocognitive action network training, or VRSCCT, designed specifically for individuals who are severely functionally compromised. By utilizing a secure, seated environment, this virtual reality protocol isolates specific articular linkages and actively works to rebuild the somatocognitive action network. Through highly immersive and targeted seated reaching tasks, the system effectively restores independent joint control, allowing patients who are otherwise immobilized to safely re-engage neural pathways and practice precise motor commands without the immediate fear or risk of falling. The clinical results of this virtual reality intervention are truly remarkable, demonstrating rapid gait restoration even from a seated position. Before initiating VR therapy, a patient's baseline state showed a severely impaired timed up and go score of 101 seconds. However, after just a single 25-minute intervention session, utilizing alternating seated reaching tasks, the patient's time dropped dramatically to 56 seconds. This extraordinary 45-second improvement underscores the sheer power of the intervention. By simulating precise weight shifting in a virtual environment, the therapy safely and effectively bypasses the neurological roadblocks causing freezing of gait, allowing the brain to rapidly restore functional walking ability. This demonstrates the immense potential of VR to unlock immediate, tangible improvements in severe cases. Another frontier in advanced treatment is the application of closed-loop brain stimulation, specifically transcranial electrical stimulation, or TES. This is not a generalized treatment. Rather, it is a highly sophisticated, synchronized neuromodulation technique. It involves precise cerebellar electrical stimulation that is actively monitored and perfectly synced with the individual patient's unique, real-time gait cycle. By applying targeted electrical currents to specific brain regions exactly when needed during the physical act of walking, we can actively modulate the neural circuitry responsible for motor control. This closed-loop system reads the patient's movement data and provides instantaneous electrical feedback, essentially functioning as a highly advanced neural pacemaker that helps smooth out motor irregularities and enhance the brain's natural, compromised rhythms. The clinical outcomes associated with targeted electrical stimulation are highly encouraging, demonstrating significant kinematic gains across multiple critical parameters. Quantitative analysis reveals substantial improvements when comparing pre-intervention and post-intervention data. Firstly, we see a marked increase in overall gait speed and velocity, indicating a more fluid and confident walking pattern. Secondly, the intervention produces a significant improvement in the gait symmetry index, meaning the coordination and balance between the left and right sides of the body are heavily restored. Finally, and perhaps most importantly for patient safety, there is a dramatic subjective and objective reduction in freezing of gait episodes, as measured by standardized scoring questionnaires. These combined improvements translate into a significantly lower fall risk and a higher degree of independent mobility. To further combat the progressive functional decline and severe physical fatigue that often accompany intensive physical therapy, we are now integrating soft wearable robotics into the rehabilitation process. Unlike rigid, cumbersome exoskeletons of the past, these modern devices are lightweight, unobtrusive, and utilize advanced cable-driven mechanisms to provide targeted hip extension assistance. During rigorous activities such as treadmill training, this robotic assistance acts as a continuous supportive force, helping to lift the leg and propel the patient forward. By reducing the overall metabolic cost of walking and actively mitigating muscle fatigue, these soft robotic suits enable patients to endure much longer, higher-intensity training sessions, thereby maximizing the neuroplastic benefits of the therapy while simultaneously ensuring patient safety and comfort. A major challenge in specialized rehabilitation is bridging the access gap, ensuring that advanced treatments reach patients regardless of their geographical location. Telerehabilitation has emerged as a crucial tool in this effort, effectively boosting the overall quality of life for patients in their own homes by providing remote access to expert guidance. Concurrently, the rise of specialized private rehab gyms offers out-of-pocket, highly intensive programs tailored specifically for neurorehabilitation. These dedicated facilities provide the necessary equipment and expertise to enable significant recovery of instrumental activities of daily living. By participating in these intensive, real-world simulated programs, patients can achieve monumental personal milestones, such as regaining the physical capacity and confidence required to resume international travel and fully participate in life once again. In conclusion, we must utilize a comprehensive Parkinson's disease care matrix to tailor specific modalities to each patient's unique clinical stage, kinematic symptoms, and psychological needs. Whether it is deploying dance therapy for early-stage multisensory integration, utilizing LSVT Big for kinematic scaling, or implementing advanced virtual reality and soft robotics for later stages, a highly personalized approach is absolutely vital for optimal recovery. Thank you so very much for taking the time to watch this comprehensive medical overview until the very end. I truly hope this presentation has provided you with valuable insights into the future of Parkinson's rehabilitation. If you found this detailed information helpful and informative, I kindly ask that you please hit the like button, leave a positive rating, and subscribe to our channel for more in-depth medical content and future updates. Your continued support is greatly appreciated and helps us share these critical advancements with the world. Thank you again, and please take care.